In the name of God, most gracious, most merciful, we would like to welcome our speakers to this press conference of the National Medical Taskforce for Combating Coronavirus with the participation of the World Health Organization, Her Excellency Dr. Faiqa bin Said al-Saleh, Minister of Health, His Excellency Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, Dr. Walid Al-Mana, Undersecretary of the Minister of Health, and Dr. Tasneem Atatra, representative of the World Health Organization office in the Kingdom of Bahrain. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Minister of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now we begin with Her Excellency Faiqa bin Said al-Saleh, Minister of Health. Thank you very much. In the name of God, most gracious, most merciful, may God's peace and mercy be upon you. We welcome you to this press conference in which we have the honor to host His Excellency Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization. First, I'd like to welcome our guest, Dr. Tedros, in his second home. This visit comes as part of the ongoing coordination between the Kingdom and the World Health Organization. And this visit will also constitute a major boost for the joint cooperation between the Kingdom and the WHO, especially with regard to coordinating efforts to combat COVID-19 virus and efforts to achieve the desired goals. And we also welcome Dr. Tasneem Atatra, the appointed representative of the WHO office in the Kingdom, which was inaugurated officially today. And this is a new achievement added to the records of the Kingdom's achievements and a recognition that we are proud of. The opening of the office officially of the World Health Organization in the Kingdom of Bahrain in such exceptional circumstances proves the great efforts made by the Kingdom to preserve the health and safety of everyone in the face of all circumstances. And the opening of this office will undoubtedly enhance cooperation, work, and joint coordination between the Minister of Health in the Kingdom of Bahrain and the World Health Organization, and will facilitate the exchange of experiences and information to combat epidemics and diseases and develop health and treatment services. And I'd like to commend the organization's important and prominent role in supporting the efforts of various countries of the world. And allow me to address the efforts of the Kingdom of Bahrain to confront COVID-19 at the local level. Under the directives of His Majesty the King, may God protect him, and the direct follow-up of His Royal Highness the Crown Prince, the Prime Minister, may God protect him, the Kingdom has developed proactive strategies and plans to deal with all scenarios even before announcing the first existing case in the Kingdom in February 2020. And all precautionary and preventive measures and early preparations and implementing the necessary measures in line with the international standards and recommendations of the WHO. And the National Medical Taskforce was formed to address the coronavirus, which is specialized in developing the necessary protocols in all levels with dealing with the virus. And an operating room was established to work 24 hours, and it is the point for immediate response strategies in various stages of addressing the virus. And in advance and before even registering the first case in the Kingdom of Bahrain, an integrated media strategy was developed, and the crisis guide for media and communication was adopted and activated in order to manage the crisis through media and use the best approach to handle the crisis in media. In addition to launching continuous and updated awareness campaigns according to developments through which all statistics and information are constantly announced in an accurate and transparent manner and around the clock through various media and multiple languages. And Bahrain followed the strategy of trace, test, and treat to limit contacts and mitigate the spread of the virus in society, in addition to intensifying random testing in various areas of the kingdom. Bahrain has provided tests, treatment, and vaccinations free of charge to both citizens and residents, which made it at a leading position globally in terms of the percentage of tests conducted. And Bahrain provided daily tests of up to 20,000 PCR tests per day to detect existing cases in order to reach them at an early stage and to provide them with the necessary treatment and recovery. And the kingdom continued to update its treatment protocol and approved various medications that proved their efficacy in treating existing cases. And the kingdom, following extensive studies by the Committee on Vaccinations and the National Health Regulatory Authority, has approved 6 various vaccines and allowed freedom of choice for everyone. It has also allowed vaccination for the age group of 12 to 17 years, as well as pregnant women, breastfeeding mothers, and the elderly at-risk groups. And as part of Bahrain's prompt response to face the implications of COVID-19 and to support the economic sectors, a financial and economic package that exceeded 4.5 billion dinars, which is about 12 billion US dollars. This was equivalent to 1/3 of the kingdom's GDP. The financial and economic packages aimed at supporting the economic sectors affected by the pandemic, as well as the private sector and citizens, and supporting wages and securing jobs in a way that contribute to strengthening the trend towards the desired economic recovery, and these packages are still ongoing. Bahrain also has been keen to enhance the digital transformation of all government services to enhance their quality, in addition to expanding the range of electronic and technological platforms. And at the international level, the kingdom never neglected its role in strengthening international cooperation to support efforts to address the pandemic in various countries. This was a summary of the efforts of the kingdom, and now His Excellency Dr. Tedros to deliver.
في هذا المؤتمر الصحفي، والسلام عليكم ورحمة الله وبركاته.
Thank you, Your Excellency. Your Excellency, Dr. Faika bint Said Al Saleh, Your Excellency Sheikh Mohammed, Head of the Task Force, dear colleagues from the media, Assalamu alaikum wa rahmatullahi wa barakatuh. We're just coming here to join the media from an excellent meeting I had with His Excellency Sheikh Mohammed as head of the task force, Minister Faika and others. You know, I started visiting yesterday, and the presentation actually brings almost everything together, and it shows how the whole response is coordinated. So I'd like to start by recognizing that. And then I would like to thank Her Excellency, the Minister, as well as the government and people of the Kingdom of Bahrain for their warm welcome and hospitality. It's a great honor for me to be in Bahrain to open WHO's new office, our 152nd office around the world. The WHO country office will deliver strategic, technical, policy and service delivery support to the government to advance health and well-being nationally, regionally, and globally. The opening of this country office reflects WHO's commitment to serve all countries at all income levels, providing support tailored to the needs of the country and its place in the global health architecture. During my visit, I have been very impressed by everything Bahrain has done to prepare for and respond to COVID-19. Yesterday, I had the opportunity to visit several facilities. First, a drive-through facility where I was very impressed. The second, that idea, by the way, is taken from the private sector process, and that kind of innovative idea and also learning from the private sector is very important. And the second is the exhibition center, which has been converted into a medical center, the red zone on one side, and the vaccination area and research area, the green zone, on the other. And I was very much impressed by the type and number of research which is being done to understand COVID. And I hope these studies contribute to the global knowledge. And I would like to commend the government for that. And third, we visited a parking lot, former parking lot, which has been converted into an ICU unit with 130 beds, which is very important for providing care, not only for patients with COVID-19, but all patients. And I learned that this 130 beds ICU unit was completed in 7 days. And you can imagine how Bahrain was doing things with a sense of urgency. And the surge like that in 7 days is very impressive. And fourth, we visited a rehabilitation and triage center, which brings everything together in an integrated end-to-end service, which is very important for providing care that is patient-centered. And then finally, we visited a mobile service using the blue buses that have converted from public transport to provide health services in communities. And if you take the two together, that's the drive-through and the mobile service. That's why Bahrain has been testing 20,000 people a day, which is, compared to many countries, really big intervention. It's because of these innovative ideas. And as you know, without testing, you wouldn't know where the virus is, and your intervention cannot be as effective as possible. So the intervention starting from testing, and that follows is tracing, and the treatment can be influenced actually by the number of cases we test, but at the number of people we test, but at the same time the follow-up of those cases or their contacts to fight the pandemic wherever, or to fight the virus wherever it is present. And then I was so impressed actually by the level of innovation, and also I said, as I said, by the focus on providing integrated patient-centered care. I was also very pleased to see the number of women involved in leadership in each of these facilities, and I have also encouraged the government to include women in the COVID-19 task force. It's pleasing to see that COVID-19 cases and deaths are now near the lowest level since the pandemic started, but I urge you not to let down your guard. That's what I expect, of course. The Delta variant is now wreaking havoc around the world, and many countries are now seeing increase in cases and deaths despite high vaccination rates. Complacency is as dangerous as the virus itself. I also have 3 requests for Bahrain. First, We urge Bahrain to continue striving to make progress toward this universal health coverage, especially by building strong primary health care. You're doing it. Pushing the same thing more aggressively will be important. Bahrain has demonstrated its commitment to universal health coverage by passing a health insurance law last year. But there are always more services to cover and financial gaps to close. Second, we also urge Bahrain to continue a comprehensive approach to protect its people from COVID-19. The pandemic is a long way from over, and every country must continue with a tailored and consistent approach of public health measures and vaccination. We also seek the Kingdom of Bahrain's support for controlling the pandemic regionally and globally. To do that, WHO's target is to support every country to vaccinate at least 70% by the middle of 2022. If we can do that, we can control the pandemic. To reach those goals, we need 11 billion doses, and we need your support and voice to make this a reality. And third, we seek Bahrain's commitment for strengthening health security nationally and based in its very strong experience now, to share its experience regionally and globally. At the World Health Assembly in May, member states agreed to hold a special session of the Assembly in November of this year to consider developing an international treaty on pandemic preparedness and response. One of the major gaps exposed during this pandemic has been the lack of international solidarity and sharing. The sharing of pathogen, sharing of data, epidemiological information, resources, and technology. A treaty could address these fundamental weaknesses by providing a solid foundation for enhanced cooperation. And we seek Bahrain's support for this important initiative. Once again, I assure you of WHO support for the Kingdom of Bahrain and our continuing commitment to work with you to promote health, keep the world safe, and serve the vulnerable here in Bahrain and around the world. Shukran jazilan. And now I would like to give the floor to my good friend, Dr. Walid, who has been taking care of me since I arrived. And
حضوري إلى المملكة. شكرا. يسعدنا تماما أن نكون بينكم. In the name of God, most gracious, most merciful, His Excellency Dr. Tedros Ghebreyesus, Director General of the World Health Organization, and Her Excellency Dr. Tasneem Atatra, appointed representative of the WHO office in the Kingdom of Bahrain, I'd like to welcome you again in the Kingdom of Bahrain. And I also welcome everyone to this exceptional press conference, which reflects in its topics the efforts of the Kingdom of Bahrain, which are recognized in various forums. Now, I begin by reviewing the Kingdom's efforts with figures and statistics, and along with the other topics. Since the first day, the Kingdom of Bahrain has been keen to enhance transparency and inform the public of all developments, which has made the Ministry of Health a reliable source for all to obtain information and statistics on the paths to dealing with the virus. And thank God, the Kingdom of Bahrain has completed vaccinating 1 million people with various approved vaccinations, which is equivalent to 70% of the total population, and 89% of those eligible and 99% of those registered to take the vaccine. Bahrain has provided more than 4.5 million doses of all kinds of vaccines to cover the requirements for this year and the year after, in addition to the booster doses. The capacity of the number of vaccine doses increased to reach 31,000 doses per day through 31 centers located all over Bahrain. Sections have been allocated for the elderly without the need for pre-registration. And the protocol for taking the booster dose has been updated to be 1 month for this group as well as the risk groups. And 44% for those aged 12 to 17 years were vaccinated, receiving 2 doses, and 63% of them have received the first dose. This was following the approval to vaccinate children in the kingdom. 2 additional drive-through centers were launched, bringing the total to 3 centers located in various areas of Bahrain. The number of lab tests conducted by the kingdom as part of its efforts to combat the virus exceeded 5 million tests, thus ranked among the top countries with a percentage of tests conducted per 1,000 people. The total of these tests is 3.5 times the population of the Kingdom of Bahrain, which is an affirmation of the keenness to reach the existing cases at an early stage and thus accelerating treatment and recovery. Also, thanks to God, within a short period of time, the percentage of existing cases was reduced after it exceeded 3,000 cases per day in late May to less than 100 cases per day during July. All these figures and other achievements and other efforts that we cannot cover now, all as a result of the continuous hard work of Team Bahrain, because they care of the health and safety of everyone as a top priority. So these efforts came together and we found awareness and commitment from all citizens and residents of the precautionary measures and the demand for vaccination, which contributed to what we are now at, to be at the green level according to the light signal mechanism. And speaking of this mechanism, it is an advanced and clear mechanism through which we either open or close sectors in the Kingdom of Bahrain. And it consists of 4 levels depending on the average percentage of existing cases. And the mechanism specifies the controls and procedures for dealing with each level of the mechanism. This also was addressed by the national campaign to combat COVID-19 to raise awareness of the procedures of each of its 4 levels. And we thank them since the beginning of the pandemic. Bahrain also strengthened communication with various segments and opened effective channels by launching the National Communication Line Hotline 444 that responds to the inquiries of citizens and residents and guides them to the proper way to deal with the infection. And since February 2020, the center responded to more than 5 million calls. And Bahrain, also one of the top countries to launch an application, Be Aware, to follow up with the existing cases with privacy and confidentiality, with some features added to have appointments and the status of the user, if they are vaccinated or not, in order for them to access facilities according to the announcements. To conclude, there is a long talk, but thanks cannot be enough for every conscious individual who contributed to the commitment of themselves and their surroundings and society and everyone. And the achievements that we are proud of today are the result of everyone's solidarity and cooperation. So thank you all. Now, I'll leave the floor to Dr. Tasneem Atatra, representative of the WHO office in the Kingdom of Bahrain. We were proud of you. May God's peace, mercy be upon you. We نهنئ مملكة البحرين.
It was and still is one of the first countries that plays a key role in addition to successful initiatives in the global response to COVID-19 due to the following structured strategy to battle the virus. WHO was monitoring the response of member states, and what was accomplished in Bahrain deserves to be acknowledged. We affirm that Bahrain's implementation of a comprehensive package of public health measures in order to combat the spread of the virus before the discovery of the first cases in the country has had positive results, including careful monitoring of the pandemic and also working on mobilizing all resources and using and repurposing the infrastructure in basis of the response that was based on information for action and evidence, taking into account the economic and social measures and how this would impact the other aspects of population. Efforts have also been made to ensure the full continuity of essential healthcare services to the people who require treatment for other health conditions and who also need to continue receiving the different services. We appreciate Bahrain's tireless efforts towards achieving universal health coverage. The World Health Organization declared Manama, the capital of Bahrain, a healthy city in 2021. Thus, Manama became the first capital in the Middle East to receive such an honor, adding a new international achievement to the kingdom's rich track record of international achievements. The World Health Organization is proud to strengthen the bonds of cooperation with the Kingdom of Bahrain through the establishment of the new country office here in the Kingdom as part of the efforts to strengthen the current partnership and the long-term strategic partnership in order to achieve the goal of universal health coverage and to ensure the protection of health and well-being of the people of Bahrain. The country office will work closely with the Ministry of Health and all ministries, government institutions, and the UN agencies, in addition to the academia, to address the priorities of Bahrain. And we will work closely as a team to advance the realization of universal health coverage and the implementation of the Sustainable Development Goals, ensuring the integration of health in all policies. Thank you.
نشكر السادة المتحدثين على هذا.
We thank the speakers for their briefs. Now, let's have the questions from the journalists who are following us remotely. Now, we begin. Question to Her Excellency Minister of Health, Budur Al-Maliki from Al-Bilad newspaper. What are the important stages that Bahrain is going to witness, and what are the examples of collaboration, joint collaboration between the WHO and the Ministry of Health? Thank you, Budur, for the question. As for this next stations, aside from COVID-19, we have, especially in terms of the health insurance, and hopefully we're going to have a governmental permit, and we hope that the media are going to be there to see the position of the Ministry of Health, and that will be among the health integrated system. As for the collaboration with the WHO, during our speech we mentioned that our collaboration started since the establishment, the independence of Bahrain in the 70s. So we have strong relationships with the WHO, especially at the executive office. For 4 sessions, Bahrain was present in the executive office for the WHO, which is among the among the important platforms to make decisions. And we in the Bahrain, by establishing such office, is going to strengthen the relationships through the joint programs with the WHO by benefiting from expertise and information and exchange our experiences to other countries. So the office in Bahrain is going to be fruitful, not just for the Ministry of Health, but also at the level of the Kingdom of Bahrain as a whole, because all the entities in Bahrain are related to health. So the office is for whole Bahrain. Thank you. Question to Dr. Tedros. How did you find the leading Bahraini experience in combating COVID-19, and how do you see this national
صاحب السمو الملكي الأمير سلمان بن حمد آل خليفة موضع اهتمام دولي وعالم.
Yeah, thank you so much. From my visit, what I have understood is that Bahrain has really managed the pandemic with a sense of urgency and with effective leadership. I think when there is effective leadership, things can succeed. And what I learned is from the very beginning, the leadership has seen this virus as a threat, and the preparation started in the early days of the pandemic. Not only started in the early days, but designed the coordination mechanism, the task force, or established the war room to follow up on the situation. The reason I'm stressing on this is it's because political commitment and leadership is very, very central to success. And then, of course, all this is to help citizens, but at the same time, the engagement of citizens is very important. And it starts from sharing information and transparency with regard to the pandemic, on what is happening, and all the information that the citizens need should be provided. And I saw that the communication flow was there, and I hope that in turn assured the citizens and also created the trust that's required, especially in such situations. So these are the two important elements, the leadership and the community engagement. And then if you take as a result, what has happened, if you take testing is central, by the way. And that's the first step for anything. And without testing, without knowing where the virus is, you cannot fight it. So from the early days, what I said the leadership had decided is to strengthen the testing capacity. And I was impressed actually that a big amount of PCR kits were ordered in the early days of the pandemic. But not only that, innovative ideas were proposed to increase the number of people that could be tested per day. So one is the drive-through, which was taken from the private sector. You can, screen people as fast as possible, but at the same time, you can screen as many as possible. So that drive-through, I think, helped in increasing the testing capacity. and the mobile service as well. And that's why you have like 20,000 tests per day. And by any standard, that's one of the large number of tests per day, per capita compared to many other countries. So you have the leadership, but at the same time, the innovative ideas, targeting, for instance, tests, increasing the testing capacity, and then having the innovative ideas to make that happen. Then on the other part is from testing. Of course, there is tracing. If you're testing 20,000 based on the number of cases, positive cases, then you will follow up the contacts of these positive cases, and imagine how big that will be. And I have seen one of the centers where they do follow-ups with contacts of the positive cases, and giving them the information and advising them on what to do based on the guideline. And the third, of course, is the treatment. And there are many innovative ideas in that respect also. Increasing the bed capacity from 2,000 to 9,000 is really, really big. And that shows how the country has been investing in increasing capacity or surge to manage. The advantage of this is, since when the number of cases increase, the existing bed or services or bed capacity can be under stress. So having additional beds and additional services frees the existing regular service, so you can avoid disruption of the regular service also. So two advantages here. When you do surges like this, when the number of beds significantly increase, you can manage the COVID cases in a better way, but at the same time you avoid disruption of the regular services you provide, because there is maternal health services, child health services, non-communicable, communicable other services that you should also do. And not only that, of course, you will have beds for some level of cases, but at the same time, for severe cases, you will need ICU. And in increasing the ICU capacity, beds capacity, then there is a very innovative idea too. Converting a parking lot, it doesn't look like a parking lot. I was inside that facility, and having 130 ICU bed units in 7 days is very, very impressive. And not only the speed, in 7 days, 130 beds, but you can also see the partnership between the Ministry of Health and the Ministry of Defense to make this happen. 130 beds ICU is big, because normally even a big hospital of 600 capacity may not have more than 40 ICU beds. So it's like when you have this 130 ICU beds, it's like bringing 3 big hospitals together. And that can give you a better capacity to manage the severe cases. When I visited, by the way, there was no patient. I think the last patient they had was discharged that day. So that was the 0 patient. Congratulations to Bahrain. No case in that facility when I visited. And you can see the number of cases really decreasing, continue to decrease, and that's why we are now at around 100 cases per day. Yeah, which is the lowest. Then, of course, the other innovative ideas, and something that you're investing and which you can see this is also because of leadership, is research. I was very much impressed. 19 publications, I think. There are some in the pipeline. Research in many areas, and they're doing the research in formerly the exhibition area, which is now repurposed to be used as medical center, and also vaccination center and research. So all you sum, I don't want to take your time. If you sum up all the response that you see, it's from end to end, and it involves all the relevant sectors, and it's patient-centered, and the leadership is there, and there is, all the support that's needed, and that's why there is result, and there is a lot that we can learn. And the result speaks for itself. 70% vaccination now, of the total population, and more than 90% of the adult population. You can see how aggressive the country is in the fight. And monoclonal, it's a new technology. I'm glad to see it happening here. 467, I think people have benefited from it. No side effect, no deaths. No one actually was referred to ICU from that facility. All are well, and that is again very important, because not many countries are actually using monoclonal, and I'm really glad to see that. And that's again a result. At the end of the day, it's saving people. So you see how committed Bahrain is to save lives, and the outcome is also good. So you cannot talk about the innovative idea, drive-through, or repurposing this or repurposing that. At the end of the day, what's the result? Save lives. What's the result? 70% vaccinated. What's the result? Other tangible things that you can see. No case now in the ICU. It's 0 case yesterday. And the number of cases also, which is now low. So there is a lot to learn, and there is a lot that we can document, and that's why I asked Ministry of Health, Ministry of Defense, and other sectors to really document all this together. It will help you to reshape the health system, your own, but at the same time we can also benefit by documenting this to share with other countries. But I'm really impressed by the process you're using, also very lean and mean and very good processes that fast, and also faster, bigger, and good quality. And that has to be used in the other services that you provide. So thank you so much. That was a very important question. That's why I took my time, and I hope you'll understand, moderator.
Thank you, sir.
The second question is also to Dr. Tedros, Director General of the WHO. A question from Iman Al-Khattab, Al-Sharq Al-Awsat newspaper. How would the WHO deal with China stopping to participate in the second phase of investigation on the origin of the virus, and how do you see the precautionary measures conducted by Saudi during the season of Hajj?
So on the origin study, as you know, we had the phase 1 study, and the report was released in March. And as you also know, there is progress. We have better knowledge, better understanding. But at the same time, there are also challenges. I have said it many times. And we have to address those challenges going forward, especially when we do the phase 2. These challenges are related to sharing data, especially raw data. And I hope during phase 2 this will be addressed. And I expect that China will continue to participate, because knowing the origin of the virus is very, very important. We cannot prevent the next pandemic if we don't know how this one started. So it's just science, nothing else. It's not finger pointing, it's not blaming anyone, it's just knowing how the virus started and to prepare for the future. And that I would like to make clear. So cooperation from everybody is very, very important. And the second point is, not only science, we do it because it's science, and we should do it because it's science. On the other hand, we should do it because we owe it to those people who have lost their lives. We have lost how many? More than 4 million people have lost their lives. And more than 180 million people have suffered. And even more, there is underreporting in that. This pandemic is unprecedented. We haven't seen anything like this for more than 100 years. The pandemic that we know is the 1918 flu. And next, after that, this is the unprecedented big pandemic that has affected the whole world and taken the whole world hostage. So, you know, knowing the origin is very important because, as I said earlier, we owe it to those who have died. Even in a family, when someone dies and you don't know the reason, you ask, you want to know. It's not because you can bring the dead person back, but it's respect, knowing what happened to your loved ones. So we should use that rationale also to know what happened, because these people, 4 million, are not numbers. They're father of somebody, grandfather of somebody, grandmother or mother of somebody, or a sister or daughter of somebody, or a brother or a son of somebody. So they're people. So we owe it to them, and we should do it because of that reason also. And, you know, considering the unprecedented nature of this pandemic, I think everyone should really, really cooperate to know what happened, and WHO will continue to push. And then on Saudi, they have done a good job. They have done their best in the recent Hajj, and the previous one also the same. As you know, there is no zero risk. What matters is minimizing the risk. There is no zero risk in life. It's either less risk or more risk. So if countries do their best to minimize the risk, I think having gatherings like Hajj is okay. And Saudi has done its best, and we cooperate with them, we work with them, and we support them, and we will continue to do so. And the same thing, by the way, with Tokyo Olympic as well. Thank you, and back to you, moderator.
Thank you, sir.
سؤال إلى question to Dr. Walid Al-Mani from Tariq Ghanem. And please, if you can cut short the answer, are the new variants are more risky on human from previous ones, and are there any international indicators or factors that we can rest assured that we are about to finish and end this virus? Well, the variants were already there from the beginning of the pandemic, and some were more dangerous, as mentioned by the Director General. Delta now is the most risky one, and some maybe they are like variants, they are less dangerous. And perhaps the second part of the question I can answer is important. Can we rest assured that, maybe dealing with vaccination and with the spread of the virus, really, those variants were reduced, and by implementing the precautionary measures, yes, we have to keep this in mind. This is just to make my answer short. Thank you. Now, question to Dr. Tasneem Atatra from Muhammad Al-Ghamdi, Sabaq electronic newspaper. What is the opinion of the WHO in mixing vaccines aside from Pfizer and AstraZeneca? Because the WHO confirmed that mixing Pfizer and AstraZeneca is safe, but what about mixing other vaccines?
المنظمة أكدت أو أعطت بناء على دراسة والتوصية أنه ممكن استخدام فايزر كجرعة ثانية لأسترازينيكا في حال لم تتوفر أسترازينيكا كجرعة ثانية. وهناك دراسة تقوم بها جامعة إكسفورد في المملكة المتحدة على موضوع خلط اللقاحات. كانت الدراسة على خلط ما بين أسترازينيكا وفايزر، والآن خلوا دراسة أكثر للقاحات أخرى مثلا كموديرنا.
They are studying the other vaccines. Just to conclude, the WHO recommends to use the same vaccine for 2 doses, and especially for my journalists, because they're always asking about the recommendation. Every recommendation is based on scientific research. So clinical trials are ongoing, and what updates are going to be based on scientific results. Thank you. Now I go back to the Director General of the WHO, Rasha Al-Ibrahimi. You expressed your pride in the efforts of the Kingdom of Bahrain. Do you recommend to share this experience with international countries, because there are levels, between country and another? Jawabi na'am. So
I asked colleagues actually to document, but until the documentation is done, since I meet many people, I will share what I have seen today with others. Shukran.
Thank you very much. إذن نكتفي مشاهدينا الكرام بهذا القدر من
conclude the question and answer section. Thank you very much, the speakers, for your briefs, and also for you for watching, and for journalists who are watching us remotely. Before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you all.